name is Ashley Delaski, and I'm doing urinary catheterization performance. First off, you're going to start by entering the room by knocking on the door, washing your hands. Hi, Miss Jones. I'm going to be putting in the catheter. Your doctor ordered it. So what I'm going to be doing is inserting a tube up your urethra into your bladder, and that is going to allow for the urine to come out. Second, you're going to ask for allergies. Are you allergic to anything? And could I have you verify your date of birth and your last name? And then you're going to go ahead and check on their armband. And then you can look on the orders to make sure that it matches everything that the doctor said. The main purpose of catheterization is to make sure that we keep it sterile, as we are directly inserting something into the human body. So at this time, I would expose my patient, put on some gloves, and make sure that my patient is washed. And then I would cover them up and do anything that needs to be done. Then I would go ahead and position my patient. Miss Jones, I'm going to expose you here. We're going to get ready to put the catheter in. At this time, you're going to take your lighting and make sure you have adequate lighting so you can see where you're going to be inserting the catheter. I'm going to go ahead and expose my patient. This is where I may ask for some help from a CNA. These are my makeshift legs. For a female, I would have her bend her knees and have her feet kind of pokes like this, so both sides would be like that, so you can have an open area to work with. So I'm going to go ahead. Then I'm going to start the sterile process. My hands are washed. I'm going to open this package on the outsides. The outside 1 inch is what is not sterile, and that is where you are allowed to touch. Now, if I were at school or in the hospital, this would be up about my waist, so I'm not having to worry about touching the sterile field with my clothes or my scrubs. I'm also going to lift the bed up higher, so I'm not worrying about bending over and hurting my back. I'm going to have this on my right side in front, behind me, and I have a garbage right below me to throw away my sterile stuff. So again, my hands are washed. I'm going to go ahead and take off this. I'm going to touch the outside 1 inch and place it underneath my patient. Could I just have you lift your bottom up for just a moment? This just provides a sterile environment where you're going to be working at. Now, if this were a male, you would open the drape, again within the 1 inch, and you're going to expose the penis through this hole, so it is, everything else is covered except for what you're going to be working on. Since we're not working with this, you're going to drop it from your waist down. Then you're going to pick up your sterile gloves, making sure you're not touching anything in your sterile field. And typically, we would have more room on this, but I'm going to move this over. So I'd have room here. And I'm going to very carefully touch the inside of this glove. And put it on my hand. Now, most gloves that come in these, I think, run a little bit smaller. So if I wear a large, I suggest anybody else that wears a large to go ahead and grab an extra pair of gloves, as the ones in here run small, so if they don't fit you, you can use that. I'm done with my gloves. I'm going to dispose of them. Now I have got my sterile field, and I have the iodine here, so I'm going to go ahead and open the iodine. Sometimes the iodine comes in sticks, kind of like a Q-tip, except bigger. You're going to want to open those and kind of pull them out so you're ready, because you cannot, once you take this off, you can't take your non-dominant hand, because that's going to be non-sterile. So you can't take that and grab onto it. It needs to keep sterile, so you're going to be able to just grab those out from there remember to drop from the waist down. Then we have the lube here for the catheter. This will help lubricate it so it goes in a little bit smoother and easier for the patients. This is a sterile cup that you would use to collect sterile specimens if you needed a UA right away. This is to check the patency of the balloon that we are going to be inserting to keep the catheter in. However, new practice guidelines, depending on where you're working at, some places don't have you test the balloon anymore because they say it is going to risk it to rupture if you inflate it multiple times. So you'll have to pay attention to your hospital policy. I'm just going to move this over so I can test the balloon. And the balloon blew up, so I'm going to bring the water back out. Keep it on there. I would not do this, but I'm going to pull my sleeves up. You break your sterile field, so when you're doing this in real life, make sure you take off any excess clothing that you may have on over your scrubs. And I am going to go ahead and pull this out, stick it in there, and I'm ready for the next step. I'm going to go ahead and grab the box, which is still sterile, and set it on over here. You're going to take your non-dominant hand, and that is going to be the hand that's going to be non-sterile. My dominant hand is going to be my sterile hand. I'm going to go ahead and grab the labia, open it up, and do a wipe down one side, toss it from the waist down, do it on the other side, toss it from the waist down, and down the middle. Now that that is sterile, we can go ahead and get our catheter out. I always make sure to loop my catheter in this hand so it's not touching a non-sterile, because if it were to touch the labia or anywhere down here, it would be non-sterile, and then we would have to start this whole procedure over again. I'm going to go ahead and get it lubed up really well. And a reminder that you actually have to keep the labia open this whole time. You can't close it, or if my non-dominant hand were to lose grip and it closed, I would have to restart the sterilization process because those lips have touched again. Now I am ready to start. Miss Jones, you're going to feel a little bit of pressure. Could you please take a couple deep breaths? At this time, I'm going to locate the meatus, the opening of the urethra, and gently push it in until you get return. Once you get return, push it in another 2 to 3 inches. Go ahead and fill your balloon up. Then you're going to slightly pull it out a little bit to feel a little bit of resistance. That means that your balloon is patent and that it is secured. Then you're going to go ahead and dispose of everything. You're going to take your sterile gloves off. Go ahead and cover Miss Jones up for the time being. Wash your hands, put on new gloves. Come back, and they're either going to have a little piece of tape that will go on here, and you're going to go ahead and secure the catheter at, or they will have a band that will go around and tape this. The catheter should be kept on a secure place below the bed, and it should be, not below the bed, below the patient's bladder, so typically secured on the bed somewhere. And this is the end of the catheter insertion.